Good afternoon. Governor Pritzker, Lieutenant Governor Stratton, welcome to Touche Regional Hospital. Welcome to Centerville, Illinois. And I want to say thank you. I want to say thank you on the backs of what transpired on this campus just less than a year ago, where Senator Belt, Representative Greenwood, and numerous other members from the Illinois Legislative Black Caucus stood up to share their vision, their bold vision, on the pillars of health and other pillars addressing communities of color and the inequities in our communities across the state. I thank you for listening to that vision. I thank you for your actions, helping to address the inequities and the disparities that too many communities, too many individuals face across our country. That bold vision, helping us to address food inequities, helping us to address healthcare access, helping us to address transportation, are all part of why we are here today, is another step of this bold action to not only take necessary reforms across our healthcare and legal system, but to take bold steps in addressing the supply need for the vaccines in our underserved communities, in our underserved neighborhoods. It is these bold steps that allow us to reach people of need, to help them understand the importance of the vaccine, and truly help us address this pandemic. These actions, Governor, Lieutenant Governor, not only give our communities hope, but they reestablish our purpose and sense of being in our communities, and understanding that we finally have not only a reason to fight, but the reason to live and progress and have a purpose in our communities. I thank you for everything you have been doing for us. I thank you for this effort of bringing the COVID vaccinations to our communities, and we look forward to this partnership, and we look forward to making progress in fighting this pandemic.
Thank you very much. Excuse me. Thank you very much, Larry, for that very kind introduction. Let me make sure my mask gets safely put in my pocket. Well, I am just very pleased to be here, Larry, with you and your team, with Mayor Maurice Jackson for hosting us. I very much appreciate the opportunity to be right here at Touche Regional Hospital in Centerville. That it's very important to me that communities like Centerville get what they need, get what they deserve in terms of healthcare access, and especially in this very difficult time as we get past this pandemic, as we make sure that people get vaccinated. I want to thank also my colleagues who I get to work with in Springfield, two of whom you know very well, who represent this area. My friend Senator Chris Belt, my friend Representative Latoya Greenwood, and two people you may not know, but you should know, Senator L.G. Sims, Representative Justin Slaughter, who both also have been true leaders in Springfield, people that, along with Senator Belt and Representative Greenwood, are looked to when others want to know, well, how should I vote on this? What should I think about this issue? That's when you know you got real leaders. Thanks to the great work of the 97 local public health departments and healthcare professionals all across the state of Illinois, we have administered in Illinois over 3 million doses of life-saving COVID-19 vaccines to our residents. So far, more than 20% of those 16 and over have been vaccinated, along with over 44% of our seniors 65 and over. That's great progress, but there is much more work to be done. Even if we had enough vaccine today for everyone in Illinois, we know that many people would still choose not to get the vaccine. So it's important that we get the message out to those who are vaccine hesitant that these vaccines are safe. They offer real protection, effective protection, and are key to ending this pandemic. All three of the approved vaccines were 100% effective in trials for stopping hospitalizations and deaths. And we've seen tens of millions of Americans get vaccinated with no trouble at all. Hundreds of millions across the world with no trouble at all. After so much time spent protecting one another by wearing masks and social distancing, and I thank everybody for following those mitigations and keeping each other healthy, what a relief it will be when we get everyone vaccinated and everyone can know that they're safe from this virus. While it's everyone's choice whether to get vaccinated, for those who have any concerns, we need to be sure that they have all the facts. It could save their lives. It's okay to have questions or even worries about vaccines, but these vaccines are safe, and it's important for you to know that. We're engaging in an effort to communicate with those who are vaccine hesitant by debunking misinformation being pushed on social media and acknowledging that some people do distrust the healthcare system or the government, but we have to meet people where they are in the ways that truly will earn their trust. We also want to be sure that we're getting vaccines to Black and brown people who have too often been denied health care that should be their right. That's why my administration has launched our new vaccine pilot program to partner directly with federally qualified health centers and safety net hospitals to better reach underserved communities all across our state. And I'm very proud to count Touche Regional Hospital here in Metro East as a partner in that effort. Starting next week, Touche and other partners will receive hundreds of doses per week directly from my team at the Illinois Department of Public Health to provide their patients beyond what the area local health department is allocated, and when supply allows, for the community at large through vaccination clinics. These new doses that are focused on underserved communities is augmented by a Biden administration program to deliver additional vaccine to FQHCs all across the nation and right here in Illinois. This state program begins with 5 FQHCs and 4 safety net hospitals around Illinois, and in the coming weeks, we'll expand it to include critical access hospitals across the state to increase capacity and reach into our most rural communities. I'm thrilled, frankly, that the increasing supply of vaccine is allowing for this much-needed expansion, but there is still a shortage of vaccine across the nation. That means that getting an appointment can be a very frustrating experience. But here's the good news. Vaccine availability is set to soar in the coming weeks. The White House has pushed supply up substantially since January and has said that they'll be able to provide us a minimum of 18 million doses each week all across the nation for the coming weeks, and millions more after that. And as I've said before, we expect at least 100,000 doses per day in Illinois by mid-March. 100,000 doses per day in Illinois. That is tremendous. President Biden has said that they'll have enough vaccine for every American adult by the end of May. I can speak for everybody standing with me today in saying this. This is tremendously welcome news, and it truly can't come soon enough. While we await more vaccine, please be sure to mask up and to take care of each other as you have been for these many months, so we can all reach the other side of this pandemic together. So thank you, and with that, I'd like to turn it over to one of our terrific leaders who I get to work with in Springfield, but he's especially a fighter for the people of his district right here in Metro East, and that's Senator Chris Belt. Chris?
Thank you, Governor Pritzker, for your commitment and your steadfast leadership throughout this pandemic. My top priority has always been and will always be the assurance that underserved communities in the 57th district have access to this vaccine. The partnership with Touche Hospital will not only provide that access, but also the trust needed to reduce the residents' fear and resistance and reluctance to receive the vaccine. I am so grateful for any additional support the state can offer during this pandemic. The faster we get these shots in the arm, the quicker we can have some level of normalcy. These additional shots that will be vaccines that will be here at Touche Hospital, that's huge. Huge in communities like Centerville, where in 2018, the USA Today deemed the poorest city, not in Illinois, but in the United States. Transportation is and has always been a prohibitive factor. And so having a place in the neighborhood, in the community, where residents can go to get these shots would be huge, and it's beneficial. And to have a place that is reputable, that's been here, that they trust, the relationships are there, is huge. We know what this pandemic can do. So we really have to get out and educate our public to the benefits of having the vaccination and the vaccine. And so I'm really, really enthused, and I'm ecstatic about the opportunity. That being said, I will bring up LaToya Greenwood, my representative. She's my representative in the 114th district, which encompasses Centerville, and let her speak as well. Thank you.
Thank you. As we continue to fight COVID-19 across the state, to know that the most vulnerable populations will have access to the vaccination is a priority. We know the statistics and how COVID-19 has impacted Black Illinoisans who have been shown to be disproportionately affected by the hardships of the pandemic, from health and deaths. I thank the governor, and I am excited to know that Touche will be a vaccination site for our community, and I encourage residents to use the location site for their vaccination needs. Thank you. And I'll call back up the governor for questions and answers. Thank you.
Thank you. First of all, let me do something that I failed to do a little earlier, and that's to acknowledge somebody that I get to work with every day, my partner in governance of this state, someone who honestly I rely upon for her great judgment and her character, and that's our Lieutenant Governor, Juliana Stratton. Before I take questions, I want to address the failed infrastructure that has been allowed to persist here in Centerville for too long, a textbook example of environmental racism. The persistent flooding and sewage area residents have experienced are entirely unacceptable, especially in a pandemic when home has never been more sacred. Make no mistake, we are going to get the Centerville Sewage Project funded. My Illinois Emergency Management Agency has already submitted a $22 million grant request to the Federal Emergency Management Agency that prioritizes funding and fixing the situation that has been allowed to fester too long in this community. I'll use every tool at my disposal as governor, my Department of Natural Resources director, working together to advocate for necessary federal support, as well as the other agency leaders from the Illinois EPA, They've all been in communication with local officials to discuss how to improve drainage and sanitary systems in the new Cahokia Heights community. While this project requires robust federal funding, as local leaders have made clear, we are committed to supplementing the effort with available state resources. This morning over in East St. Louis, I stood with area lawmakers, as I do today, and also with advocates from Metro East to say that Illinois is bringing more justice and more fairness to many who have so often been forgotten. But that work is far from over. True justice and true fairness means a safe house, clean streets, clean water, and clean air. It involves solutions that work for all of our communities. And we are going to find a way to fund a solution that works for Centerville so that residents and their children can have the community that they deserve. So thank you, and with that, I'm happy to take questions from members of the media. Yes, hi. So a couple of things. This is a question about access to appointments if you're not computer literate or don't have a computer. And there are two things to keep in mind. One is that there are places like Touche where you can call to get somebody to help you with an appointment, but also the local public health department and our Department on Aging has local offices or local agencies that they work with that you can contact to have them help you make the appointment. So they'll do it by phone for you, working with you to get that appointment. So I'm very concerned to make sure that everybody, if they don't have access to the internet, that they can get someone to help them. So one last thing, and it's an entreaty to everybody who's listening. If you live in Centerville or you know someone who lives in Centerville who does not have access to the internet or isn't able to use a device to make an appointment, please help that person out. Please reach out, your grandmother, your grandfather, your aunt, your uncle, just a friend, a neighbor who may be older or may not have a device. Please reach out to them just to ask them, do you need help? People have done that all across the state, and it's been truly beneficial. We have official channels, but that's sort of an unofficial way that people have been helping each other out. Thanks, everyone.